Hi, everybody, and welcome to the Lymphedema Patient Roundtable. And I know what you're thinking. You are saying this is not Alexa Ercolano, but Alexa's on the screen. And so it's kind of a special homecoming for me. My name is Brenda Viola. Many years ago, I started the Lymphedema Patient Roundtable and handed it off to the very capable and amazing Alexa Ercolano, who is your host and producer. But as you know, she was preparing for surgery, so she asked if I would be a backup, which is a total honor. And yet, here she is on the screen, and we want to get to exactly what's going on there. But in the meantime, let's say a hello really quickly. Of course, our medical expert, Karen Ashforth. It's so great to see you tonight. Angela Jones, who's a little bit of a froggy throat tonight. She's losing her voice a little bit, but she always has good stuff to say. So we will preserve your voice, Angela.
Thank
And
you.
Catherine Rosenberg is with us as well. And then Alexa zooming in from Cleveland. But we want to know, where are you zooming in from? Let us know in the chat who's out there. We're so delighted that you could join us tonight. And thank you for letting me be your stand-in host. So Alexa, spill the tea. What is going on?
Oh, goodness. Well, hi, everybody. It's so great to be here. And thank you, Brenda, for covering, because originally I thought that today I'd be coming off of a full day of an ICG, the indocyanine green, that's right, a scan and preparation for surgery. I was scheduled for surgery on Friday with Dr. Wei Chen here at Cleveland Clinic. And that's why I'm here with Nazreen, who's also based in Cleveland. But I got a call Monday while here in Cleveland that Dr. Chen had a family emergency. So all my appointments, the surgery, everything was canceled. So it's rescheduled for the spring, but it was this huge emotional blow of like I had spent the last couple weeks, months, preparing mentally and emotionally for this procedure. I had been doing 2 weeks of complete decongestive therapy, taking the bus to my appointments, working late to keep, make up for the time that I was at the appointments, all this. And it was just like, wow, okay, now what, and it was a little devastating at first, but then I had kind of this emotional pivot of, I'm a big believer things happen for some sort of reason. Maybe I wasn't fully ready yet to have the surgery. Maybe Dr. Chen would have been a little distracted, with things going on or whatever it may be. So I think this turned out okay, overall. And I get to be with Nazreen, and there's a pediatric support group meeting later this week that I'm going to be able to attend with some of my camper friends from Camp Watch Me. So that's exciting. So this trip still has purpose, and it's also kind of a forced pause because I've just been going. It's like, okay, I'm just going to take a breather in Cleveland. And so that's kind of the situation,
Well,
right?
I love your phrase, an emotional pivot, and that's something that we all have to navigate, whether we have lymphedema or not. And sometimes things just don't go according to plan. And by the way, I apologize, Nazreen. I did not properly introduce you,
That's okay.
but I love the ability for the two of you to be together in the room while you're zooming in for the roundtable tonight. Nazreen, what do you recommend when there is a pivot like that? Surgery's planned, you've got everything, all the ducks have lined up, and then all of a sudden the rug gets pulled out. Is
I
this a
mean,
common thing, or?
it's not a common thing. It's really not a common thing. And honestly, Alexa is like a very good person for it to happen to, because she is just such a positive person. But it is frustrating for anyone anytime medical appointments get changed and life changes. I do believe, like Alexa says, things do happen for a reason. So you have to just try to keep that in mind and know maybe from what you have done, what worked and what didn't in your preparation for surgery. So maybe Alexa did the bandaging, she did stuff, and maybe she thought, oh, maybe I did a little bit better wearing my garments beforehand. I didn't need to do all of this, or I don't know her full outcome, but what worked well, what didn't, she's now learned that. So she'll know come May what she really needs to focus on this time around. And Alexa gets to hang out with me all week, so that's really fun. She's
Here's
going
a
to come to my
bonus.
clinic tomorrow, and then we're doing a pediatric lymphedema support group here in Cleveland to give some community to our peds patients here. So I'm really excited she gets to join us. So
Well, I'm glad that she has the support of her family there as well as you. You know, Alexa, we are all with you and all rooting for you. And we know that the timing will be perfect and the outcome will be the highest and the best. There are some people that maybe weren't familiar with the procedure you were having. So do you want to explain that real quick and how it
Sure.
relates to lymphedema patients?
Of course. So, and forgive me for not explaining that earlier. So I was scheduled to get the SAPL, which is the suction-assisted protein lipectomy, which is that specialized liposuction for lymphedema patients, kind of like a debulking. And then the Matisse, which you'll forgive me, I don't remember what that stands for.
Minimally invasive tissue excision and skin excision.
There we go. And so that's to kind of tighten things up if there's a lot of loose skin after moving all that volume, because some of the people in the chat are saying, for example, Diana said she got 2 liters out of her left arm. So like a lot of stuff can come out of your limbs. So they got to kind of tighten it back up after. So so that was going to be the procedure because my lymphedema is solid predominant. So that's why that's recommended versus doing like the LVA, which is lymphatic venous anastomosis, which is usually people who have more fluid predominant benefit from that first versus like a debulking one. So that's all the big long words, but that was the plan, and it's still the plan. It's just gonna be a little longer.
Just a little bit delayed. Well, we're so glad that you're still able to join us on the panel night. And those of you who have logged on, if you are a first timer, let us know in the chat. And we want you to know that no questions are off limits. Maybe you're very new to a lymphedema diagnosis and you need to know some of the basics. Well, we've got experts here that can talk to you about that. Maybe you are new to LymphaPress and you just received your pump and you have questions about how to use it or, you know, different protocols. Feel free to put those in the Q&A. We are here for you. We have a tradition, and this is a tradition that Alexa started, lymphatic gratitude. And you might be rolling your eyes and saying, I'm not grateful for this. This is not fun. And I get it. But a lot of the things that we never asked for in life end up being the very tools that somehow change us or bring people into our life that we never had before. Just imagine, here we are gathering tonight, and what brought us together? Lymphedema. So in this theme of lymphatic gratitude, does anybody have any thoughts on this? And I know your voice is a little bit scratchy, Angela, but anything you would want to share?
Well, there's a saying that I really used to hate, and that saying is, it is what it is. And I realized that it's a very freeing statement because is what you make it. And that's the way I look at the lymphedema. It's what I make it. If I decide to hate it, well, then I hate it. If I decide to just take care of it, then I take care of it. So I think I'm very grateful that it is what it is.
That's very well said. Thank you so much for sharing that. And interestingly, you said, I can choose to hate it. And then you're almost like fighting against what is, which takes a lot of energy. And sometimes going with the flow. When I asked you how are you going to be able to participate tonight, you said, well, I'll just go with the flow. And when we go with the flow, things happen a lot easier in our lives. Absolutely. I am so glad Mildred is with us. It's her first meeting, and she just received a tribute night to wear every night. So good for you for taking care of yourself. We give you a thumbs up on that. We are here to support you and cheer you on. Karen Ashforth, what would you say to someone who is attending the roundtable for the first time, maybe new to their diagnosis? What is a beginner tip you'd love to just give to Mildred?
Well, hi, Mildred. Thank you for joining us. And I also want to make a shout out to Claudia, who is someone that I know who is here for the first time. And thank you for being brave and checking out this crazy group of people. We're actually pretty wonderful, even though we're a little crazy too. And just ask questions, use the chat, because we have all kinds of cool information that happens in the chat. And just make it your group, because that's what it is. We're here for you.
Connection is what it's all about. Yeah, that's wonderful. What about you, Catherine? Anything on the under the umbrella of lymphatic gratitude?
I think this is a hard one. This is a hard one.
It
Because
doesn't just have to be about, protocols and procedures and exercise and elevation,
in all honesty, I think my lymphatic gratitude is that I have doctors that listen to me and really, when I say listen, it's not that they're just hearing what I'm saying. They're actually hearing it and acting on it. And that is a huge part because, as many people know, back in August when we had the roundtable, I was in a hospital bed. And I was there because they listened to me and they realized what was going on. And they helped to get me to the point where I am now. If they didn't listen, I wouldn't be where I am. And it's really important that when you really feel strongly that you're not being heard, that you have to say something and be very direct and upfront with them that you are not being heard or you're not being heard correctly, so that they understand what's going on. Because unfortunately, many doctors don't necessarily always want to listen to the patient, yet we're the ones who are in that body and living it every day. So we know what we feel. And as lymphatic patients, we are really good at identifying when something is not right because we know what it's like to when we feel correct, because our body is different. So we've had to learn to adapt to it.
The body does not lie, and you need to listen to those cues. Absolutely. And your point about being an advocate for yourself. There was a day back in the day, my era, when you just never questioned a doctor and it was, yes, sir. And, I saw you nodding, Karen, and I saw you nodding too, Nazreen. It's important that patients speak up for themselves and ensure that they're heard. What's a way to approach that so that it's not necessarily offensive, but can build a bridge for communication? Any thoughts?
Maybe if you try to approach them and ask your physician if not being like, hey, have you looked at this research? But hey, I was talking to somebody who maybe this worked for. So make it more like you're not trying to tell them that this is your idea. I know that sounds horrible, but I feel like people respond so much better to that. But also, if you can find somebody yourself who might be able to help, to ask them if you could get a referral to see that person who might be able to help. So I know a lot of people are advocating for themselves. So they're doing a lot of research, finding physicians online, finding therapists online, or even, finding yourself to a lymphedema therapist might be a great way to start too. So if you could ask your physician to kind of route you to someone who might be able to help and is wanting to help you, I think that would be an easy way to start.
Very good answer. And did you have anything to add to that, Karen?
I love everything Nazreen said. I couldn't add another thing.
Well, that's perfect. So inquiring minds really want to know here, and people are asking Alexa if you could describe your lymphedema journey, the cause, length of time, how and why you are a candidate for your procedure. How does it work? What's the recovery? Because, Anita out there is interested to know if it might apply to her. And I've realized that, I'm putting you in the hot seat, and you were supposed to sort of have a breather tonight, but
That's okay.
people really want to know about your journey to get to this point, because you've had lymphedema. You are a primary lymphedema patient, which means you were born with this condition. Why now considering this procedure?
That is a very good question. I'll try and give the Cliff Notes version because I don't want to take up the whole time, because I could with this. And I'll throw a link in after too. I had written a blog post after my consult with Dr. Chen back in March, which has a lot more backstory too. But so I was born with lymphedema. Nobody knew what it was, of course, at the time in the early 90s. And my parents took me all over. I'm from Baltimore, so they took me to Hopkins, and even they had no idea what was causing the swelling. And it wasn't until I was 14 and my mom had a friend over for dinner who's a plastic surgeon. And I asked her, is there anything you can do to make my leg smaller? Because I was, in middle school, I was just starting to get teased for my leg and feeling like it was this negative thing. Like before it was just, oh, I have one leg bigger than the other. I have, blue eyes, curly hair, and one leg's bigger than the other. It's just a part of who I am. But after I started getting teased, it was like, oh, this is a bad thing. This is, something I need to be ashamed of or try and change. So I asked my mom's friend, and she took one look at it and she poked her finger in my puffy little foot and she said, oh, that's fluid. That's lymphedema. Like, don't let anyone cut into that. And so ran up to my computer, Googled it, saw all the scary pictures, of really severe cases. And I was like, oh my God, this is going to be my life. Like, this is what's ahead. I can't cope with this. So luckily we found a lymphedema clinic nearby in my city. And I was very non-compliant for many years. Teenager and compression, they just don't, they don't really jive. So that I paid the price for that by getting a lot of fibrosis and all of that over the years. So I'm speeding ahead. In my 20s, I started actually wearing my compression, but I never really thought I was a candidate for surgery because my leg was pretty mild visually, like volume wise. It didn't look like it was that bad that I would need to surgically do anything about it. But I was told back in 2019, I first met Dr. Wei Chen at a conference, at a National Lymphedema Network conference. And he did this imaging study on me on stage in front of everybody. And afterwards, we were kind of talking about what he saw. And he brought up that I was a candidate for surgery. And I was floored because I never thought that could be me. And he explained how, just because you don't have the volume, it looks like it's this, that much different. That doesn't mean there's not changes happening underneath the skin, like physiologically to my tissues, to all of that. And when he put it that way, it kind of clicked like, oh, yeah, maybe I do need to do something about that. Maybe this would help me. And when I went back to my home to my clinic, my doctor was like, you don't need surgery. No. But the CLT who was in the room after he left, she hung back and she's like, hey, hope this isn't overstepping, but if I had lymphedema and I knew there was something that could help stave the progression of it, I would do it, because that's kind of the point. It's not going to cure it. I'm still going to have to wear compression. I'm still going to have to pump. I know all of that, but it's going to help the progression because it's been progressing now. And I'm sorry, I'm fast forwarding the narrative a little bit.
I wanted to stop for a moment
yeah.
because first of all, Alexa, everybody in chat is like, thank you.
Oh,
Thank you
gosh.
for sharing. Like, this is deeply personal, and yet you've chosen to be open and transparent to this audience because you want to help them. And, you don't have to fast forward through any of the details because I can just see this progression. Like when you said that you were bullied, I think we all felt it in our hearts when you said that. And yet, look at who you've become and such an advocate and spokesperson for the community. And then to get to the point where you're considering surgery only to have your doctor say you don't need it. Oh, that had to be such a sort of crisis point. Like, this is the doctor I've been going to, and yet this preeminent surgeon says it could help me. How did you weigh all that? Was it the woman who said to you, hey, I hope I'm not overstepping, but
Yeah, she was kind of that bug in my ear. I never forgot that. And I kept thinking about it. And so I would see Dr. Chen at other conferences and stuff, and he would, bring it up and be like, hey, you can call my office if you're ready for surgery. And I kept being like, no, 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 I'm not ready, or I don't know. And then this past February, I had cellulitis for the first time in my now 33, 34 years. And that completely kind of threw me back. So I had never had that before. I know I have a lot of friends who get it a lot, and I knew it was serious and it could be very serious. And thankfully I got antibiotics in time and advocated for myself at the urgent care, because they don't know lymphedema. And she thought it was folliculitis. And I said, well, I have a lymphatic condition. I'm at risk for very serious infection. Can you please prescribe me antibiotics? And she did, thank God, because I would have ended up in the hospital if she didn't. So after that, I was like, okay, I think it's time to get in with Dr. Chen, make the call. And I'm so glad I did. And he even said, because I had that infection, that's kind of a sign that like my lymphatic system is not performing like it used to. Like it's time sensitive to get this done. So it was a really big decision, but I feel very ready for it. Now I have to wait a little bit longer, but it is okay. I'll
Yeah.
continue managing. We're so used to having to adapt day to day living with this condition. So this is just another part of it. So
Well, I think that this is really helpful. And you mentioned cellulitis. Now, you
yeah.
probably discussed that on this program at length, but for those who are not sure of the warning signs, cellulitis is not something to play around with. It is your body talking to you that it needs attention. And Karen, can I ask you or Nazreen to talk about what some of the warning signs are and why time is of the essence and get it taken care of?
Well, I would like to say, because I actually just delivered this lecture at the University of the Pacific Doctoral Physical Therapy program about cellulitis and lymphedema, but I don't want anyone here to freak out, because the signs of cellulitis and erythema in the lower legs can be very similar. So the signs to look out for cellulitis are redness, heat, pain, and localized swelling. But the important thing to keep in mind is that it's not usually starting in a large area. Usually it starts small and grows. And there are patients that I've had that have red bands around both ankles, which is erythema. It's an inflammatory condition, but it's pretty much chronic. It pretty much stays the same. The thing about cellulitis is that it changes to the point where if I have someone that comes in my clinic and I'm suspicious, I'll take a Sharpie and I'll draw around that red area. And at the end of the session, I can usually tell something's happened. And I have walked more than one patient from my clinic over to ER and said, you need immediate attention, and at least one patient has been admitted. So it's not a joking matter. You want to get care as soon as possible, whether it's emergency, urgent care. I've even had some of my patients go to their primary doctor and, weasel their way in that afternoon, but it's got to be taken care of. It's a very serious thing. And I even have patients who get a prescription of antibiotics to have on hand in case there's a weekend or they travel. And that way they can start the antibiotics right away and then call their doctor the next business day and say, hey, this happened. I started this. I wanted you to know. But that way you're covered.
That is so good. And I know that you were going to jump in as well, Nazreen.
Oh, pretty much everything Karen just said, probably not as eloquently, but I wasn't giving any presentations last week. But I did just have a patient last week who sent me a picture of a slightly red leg. And then I did ask her too, aside from just the way the leg felt, but also, are you feeling fluish, feverish? She was kind of out of it. It was actually for her daughter. and she was out of it. And I said, go directly to the hospital. Like, don't, pack a bag. You're going to stay. She was there 4 nights. So it is really something to keep in mind. But the one thing that I do like to tell people is that if you do have the cellulitis infection, it's great to get in with an infectious disease doctor too, because they seem to know a little bit more about the condition. And sometimes your PCP might not be as apt to just hand you out antibiotics to have for the weekend, but the infectious disease doctors I haven't really run into a problem with them doing that at all.
That is such great advice. Go ahead, Alexa.
Real quick too. So my presentation of cellulitis wasn't very typical, and Catherine knows too, because she gets it the same way. It was like polka dots on my leg. It wasn't the flat red area, it was dots. And so that really freaked me out when I took off my garment and I saw all these spots. I was like, what? But I knew enough, and my body started feeling really off, and those flu-like symptoms, and just like the worst night of my life, feverish, chills, sweating, all of it. And so it was like, okay, this has to be cellulitis. And it was. So you got to listen to your body and speak up, when you know something's wrong.
Go
And
ahead,
if you
Catherine.
feel bluish, you're not going to want to go anywhere. So that's when you might want to educate the people around you to nudge you and support you, because you need to get on antibiotics right away. It can be life-threatening if you don't. And another little piece for quality of life is that after you finish the antibiotics, you might want to consider taking some probiotics, because the antibiotics get rid of all the bad bugs, but they get rid of the good bugs in your gut. And people who've been on multiple courses of antibiotics often end up with gut problems. So being able to replenish the gut flora is a nice thing to do for yourself afterwards.
I just feel like this is a really important conversation we're having here. Catherine, jump in.
So as Alexa said, that she presented differently, as did I. So the last battle of cellulitis that I had actually lasted a really, really long time, because they didn't realize how severe my cellulitis was. I actually wound up with a blister, and it was a fun blister. That even Karen said to me, she's never seen something like this. But I had it outlined, because we talk and we know that we outline things, and I outlined it before I left my house. And by the time I got to the facility where my treating physicians were, which was about an hour and a half from my house, it had expanded about 3 centimeters in each direction. So I knew we were dealing with something pretty serious. So I knew what the protocol for me always was, because I've had over 50 battles of cellulitis myself, in a course of 15 years, and I hadn't had an infection since 2015. And that was actually the first lymphatic surgery that I had actually stopped the infections from actually happening for me. But the problem is a lot of the physicians in the ERs, they don't necessarily realize the severity of it when you're dealing with advanced stage lymphedema, and they try to do things very basic. And unfortunately, that did get me into quite a bit of trouble with this last battle of cellulitis, to the point where the infection never went away, and it just kind of was masked, and because they didn't treat it long enough. And so I didn't get the symptoms up like on my skin. It had gotten down deep, so it didn't, it wasn't showing the symptoms on my skin until it got to a really severe point where it actually broke a hole in my skin. So that's where, I had to really self-advocate for myself about what was happening. And I really didn't know that this was actually happening until I had stuff coming out of my leg that was definitely not normal. And I really pushed and pushed and pushed to make sure that they understood what was going on. Because one of the things for me, as most people on here know, I'm a pediatric cancer survivor. That affects my white count. So my white count on a normal basis is like 4.8 to 6. So when my white count is like 8, 8.5, 10, 11, which are all normal numbers on the scale, that is really high for me. But people don't know what my normals are if they don't have medical records from previous when I'm not infected and don't have anything going on. So
Catherine, I think your point is so well taken, to listen to your body, even if you're not getting the attention you need, if you know something is wrong. And I'm not cutting you off, but at the same time, I'm listening to my friend Karen Ashforth. We don't want to freak anyone out.
right.
We don't want anybody to, but we want you to be aware that it is a thing that can happen. And Karen, why are lymphedema patients susceptible?
Wow. Well, okay. I just taught this to my doctoral physical therapy students last week as well, which is that the lymph system is part of the immune system. And part of the function of the lymph system is to clear out fluid, but also a lot of solids, which can include bacteria and viruses. So imagine you've got this system that's a little slower, and the bacteria maybe doesn't evacuate as quickly as it can. And then if you've got fibrosis blocking the pathway for the lymph system, it can really take root and form an infection. So that's why lymphedema patients are more susceptible, is because the mechanism of cleansing the body from bacteria is impaired.
So go ahead, Nazreen.
I am just going to say real quick too, if that fluid stays really stagnant, that can be a problem. So I am going to say that I love to have my patients use their LymphaPress.
I was just saying,
Yay!
is this the perfect entree for the LymphaPress? Because the whole point is it's not keeping the fluid just stagnant there. It's actually pumping it out, and you can eliminate. So, you had said, Alexa, that you were not a very compliant patient in your earlier years, and we got older and wiser. So compliance, and the nice thing about the LymphaPress is it's so easy to use as well. There's no reason why you can't have me time, get in there and pump and keep the fluid moving, because we definitely do not want to get in a situation where cellulitis is there. So thank you for letting us take that rabbit trail, because I think it's an important one. We have a couple questions in the Q&A. An anonymous attendee asks, and it's a surgery question, so it may not, we don't have a surgeon here at the table, but we have really smart people. So has anyone ever had difficulty after having the liposuction surgery with the skin excision? What if too much skin is removed? Is it better to wait a while after the liposuction before removing skin? Nazreen, go for it.
I have seen problems. I have seen problems where the skin is pulled too tight, where there's wounds after surgery. I mean, I do have this, and I've seen pressure issues too after surgery from things just being way too tight. I do have a lot of patients who do like to do it one step at a time now, and that's probably what I would recommend at this point. Based on what I have seen, although the surgeons, when they do maybe do a liposuction or a suction assisted protein lipectomy with, maybe a brachioplasty, it'll remove that tissue, or a thigh lift, they do something different where they measure the amount of skin to know whether it's warranted to take it or not. I don't fully know that whole science, but I definitely have seen people with concerns from it, and tissue restrictions, and down to the fascia, scars are very tight. Unfortunately, if there's changes in weight after the surgery too, that can also cause problems, because you now with those surgeries have long incisions from time to time. So then if you maybe have a gain in weight, it can pull a lot of pressure right on that incision too. So not that that's something to do with the surgery, but I have seen that be a problem as well.
Thanks for explaining that. Renata Schnitzer is in the audience tonight, and she is hoping to have a surgery with Dr. Chen. She is using her LymphaPress, and she wonders about occasional neuropathy type pain. Might that be a setting adjustment that she needs to consider? And we certainly are not going to diagnose anyone. We're not seeing you in person, and this is not a doctor's appointment, but neuropathy type pain from pumping, any frame of reference for that? Go ahead, Nazreen.
Sometimes, and I don't know what your leg looks like, but sometimes I have patients in the past where they're just not used to having their legs straight. And sometimes just even having that pump pull them into quote unquote like a normal position, a full extension of the leg can cause some changes in the nerve. So I've definitely seen that. And I've had those patients do stretching, and it actually really does help a lot. So if they stretch before they're going into pumping, and after, and kind of can work with physical therapy too, to work on their balance, their strength, because a lot of times we focus on lymphedema treatment and we're looking at bandaging and all of this, and we kind of miss the fact that, oh, our limb was one size and now it's a different size, or maybe because of the shaping of our legs, we're walking a little bit differently. And sometimes I feel like once we get into a pump and it just straightens us out, or even the position you're in while you're pumping. So if you're sitting upright and you're not that way and that leg is straight forward, that can cause some pain or that kind of neuropathy type symptoms. Also just, it could be just compression. I don't know if you're wearing something underneath while you're pumping that's maybe binding. We definitely could see that would be causing some of those nerve type symptoms too.
That is such a great answer. I never thought about the fact that the leg is now in a different position than it normally is. So stretching could be a really good protocol before pumping. Excellent. Thank you so much for that. So here we are, and it is Thanksgiving, and we have so many different tools in our toolbox, from the Lympha press to your compression stockings to exercise and movement. And Angela, I've always known you to be one to come up with a healthy meal. In fact, your posts on Facebook definitely inspire me. So when we're approaching Thanksgiving, are there any lymphy-friendly foods that perhaps we should be considering?
Excuse me. I think just to stay with what's healthy for you. I found out a long time ago, just because something's healthy doesn't mean it's healthy for everybody. And I would say, whatever you eat, pay attention to how your body responds. I'm not a big dessert person, but I'm always trying to figure out how to make desserts for one or desserts for two. Today I made a really weird chocolate cake. And this chocolate cake was made in a blender, blended in a blender. It was 1 apple, chocolate, and 1 egg. And it was blended in the blender, put into a souffle dish, and baked in the oven. Well, it wasn't good.
Oh, meanwhile, I'm thinking, when can I get over there? I want some of that, and it wasn't good.
It was not good. It ended up in the trash. But I made the same type of dessert. I'm always into, if you're going to do a dessert, do it healthy. Try to figure out a way to stay away from the sugar, because it is inflammatory.
So that is a really great statement just there. Sugar is not good for your lymphatics and for lymphedema patients. And you're fortunate that you don't have a sweet tooth, Angela, because some of us do. So
Every other kind of tooth, though. So
yeah,
it's not that fortunate. But I think I see the kitchen, especially for people with chronic disorders. I see the kitchen as a lab more so than a kitchen, because you get in there and you play with the foods and you make them taste the way you want them to taste. And then you pay attention to what happens after you eat the food. If the body doesn't have a positive response, then toss it out. I just throw food away because it doesn't work for me. So I would just say, pay attention to your body. And if you want dessert, I think make really good choices during the holidays. I mean, if you want chocolate cake, real chocolate cake, eat it, but don't eat the whole cake.
not the whole cake.
Just eat what is considered a really normal slice. And then I don't think it's a good idea to deprive yourself. I think you should have what you want, but I think you should practice modification.
Well, Well said. People are loving your phrase, the kitchen is a lab. And Fenton from Trenton would like us all to take note that stressed spelled backwards is desserts. So I think that that is brilliant insight. Fenton, I've missed you, buddy. It's so great to know that you're still out there supporting the lymphedema community and in the audience tonight. Any other Thanksgiving dinner tips for the lymphedema patient? I mean, I think your wisdom in just being balanced, don't deprive yourself of anything, but anything else to consider? Oh my goodness.
Quick draw.
We've got double trouble in that square. Okay, go for it, Alexa and Esri.
I'm gonna be 2 seconds. I'm just gonna say everyone's gonna overdo it. It's what happens, and a lot of the food is high in sodium. It may make you swell. What I always like to tell people is to manage your lymphatic load. So, going into it, if you know you're gonna have a little bit more salty food, you might need to pump more that day. You might need to do a little more exercise. You might need to wear your heavier compression garments, and you might need to do that the days before, the days after in preparation, and then to make up for what you've done. So there are ways, if you are going to want to do the full Thanksgiving dinner, to kind of remedy for that.
It's like Olympic training. You have to practice getting your pump at a time. Well, I was going to add too, I mean, managing, of course, and like whenever I know I'm going to have something with sodium's a big trigger for my swelling. So I love pizza. I love, I can't help it. So I always drink like a lot of water. I mean, I drink a lot of water to begin with, but if I'm going to be having something with a lot of sodium, like pizza or Thanksgiving stuffing and the canned cranberry, jelly and all that, I make sure I'm compensating by having a lot of water. And also elevating after the meal is a great way to get out of having to clean up and do the dishes. I'm just saying. So if you want to use that, be like, hey, sorry, I got a medical condition. I can't help. I'm so sorry. You can lean on that too.
That is so sneaky and scathingly brilliant. I love that, Alexa. Wonderful. I also think that managing, so I was thinking about the word November begins with the letters N-O. And sometimes you just got to say no to some stuff. Like that cranky relative that you sit next to every Thanksgiving, get your seat moved. Say no to sitting next to Aunt Gertrude this month, because boundaries are so important, because we're not just managing our physical health, we're managing our mental health. And sometimes the holidays can be full of stressors, like the family members who definitely know how to push your buttons. So try to keep your buttons far removed from them. That would be my advice this November. Any other no advices before? My goodness, this hour is going by way quickly. Any other no's for lymphedema patients? Things you should say no to this November? We talked about sugar.
I think knowing your limits, if that counts for a no.
Very good.
Which kind of relates to what we were just talking about, but even like activity wise too, like I'm someone who kind of likes to, or tends to push it sometimes because I'm a people pleaser, whether it's with work or with family or trying to just keep up physically with other people. So knowing my limits, knowing when I need to sit down and pull up a chair to elevate, or when I need to stand up and get moving a little bit to get my lymph moving, whatever it may be, it's just being attuned to yourself and speaking up for those needs that you have, because no one's going to speak up for you but you most of the time, so you have to be in tune with that.
That is so good. And I heard in the chat here too, alcohol. Alcohol can be a real trigger for your lymphatics. Any other no's? And put in chat, what are you going to say no to this November? Meanwhile, Karen Ashforth is hoping that you can say yes to an opportunity that she has coming up for lipedema patients. Now, for those of you unfamiliar, lipedema is different from lymphedema, although oftentimes, like in the case of our dear friend Angela Jones, she has both lymphedema and lipedema. Lymphedema usually affects both limbs. No, sorry, said it wrong. Karen, get in there and help me. See? See, I host the Lymphedema Patient Roundtable, which is the third Wednesday of every month. Feel free to come and join us. Disproportionate fat grows on your body despite diet and exercise, and it is bilateral, meaning it happens. You'll see that shelving in the hip area. But again, I'm going to let you talk, Karen, because you're looking for volunteers in the Tucson area.
So we've got two opportunities. And the reason I wanted to share with this group is because even though lipedema is different from lymphedema, a lot of people with lipedema have lymphedema. So we're all allies here. And if anyone lives in Arizona, particularly the Tucson area, I'm going to be conducting a research study with Dr. Karen Herbst at her clinic in Tucson in January, February, and March of 2025. And we are at the tail end of recruiting research assistants. And it is going to be so much fun. We're going to have a blast. And so you can either be there in person a day or two a week, or there's even ways you can help us virtually. So I'm going to drop an email in the chat that you can use to contact me. And we're not ready to recruit subjects yet. So I don't want to open the door too wide because we're going to get mobbed, but we are going to be recruiting subjects for our study. And it's all about self-care of lipedema. And by the way, some of these techniques could be useful for lymphedema too. So whatever we get in our research is going to help everybody.
That is wonderful. And we will definitely put the contact information in the show notes because we know many people aren't here for the live, but they are watching the replay on YouTube. And we are so excited about this research that you're doing and how you've really devoted your career to helping people and learning more and pushing the envelope and coming up with new protocols. And Catherine, you had a new protocol come up this past week, but it wasn't it was actually a funny. It was not something that was correct. You're muted.
I just found that out. Sorry. Yes, I did. So it was actually kind of funny. And it's something that I didn't think I really needed to be really clear on. So I had to have a surgical procedure to help with some things that I had going on. And I brought my compression, which I talk about all the time, that I always provide my compression so that they can put it on afterwards. I learned really quickly that we need to be very clear on the order in which things go on. Okay? So, as we all know, when we have surgery, you typically are given these lovely slipper socks. They're the lovely yellow, red, blue, gray. They're really kind of boring. And they put them back on, which is fine. However, they put them on underneath of my compression. Therefore, so they put that on, and then they put my Jobst Relax on, and then my Velcro wrap on top, which is what I typically will wear when I need a little bit of extra oomphy comfy compression. But I don't put the slipper sock on underneath, because if I was to get up and walk, I would have fallen and gone slippity slidety all across the floor, because there is no grippies, enough grippies, I should say, on the bottom of a Jobst Relax. So I have now learned that I have to be very meticulous in sharing with whoever is going to put back on my compression for me exactly the order in which it must go on. Because I woke up from this procedure and I see this and I'm just like, please tell me I'm joking. So my mom walked in and she goes,
oh my goodness,
Catherine, why is this sock underneath? I'm like, I don't know, but we got to take all this crap off. So I proceed to go do this. And they look at me and go, you can't take that off. I said, no, we're taking it off because I'm going to have a blister because of what they did. So we need to make sure that I don't have that. So let's go. Off it comes. And they just looked at me. I'm like, I cannot believe you're taking this off. The doctor just put this on. I said, yeah, he put it on because I provided it to him. So we're taking it off and fixing it the right way. So I then put it on correctly, and they went, oh, the slipper sock goes on the outside. I said, where
Oh,
did
they
you
had
think
their own.
it
Well, it
went?
was a teachable moment, Catherine. You were able to help educate
Yes.
them, and I'm glad you saw it before you got a blister and all that. But
Well,
yeah,
like that was my biggest worry, but
yeah,
because when you have things that are layered that move around, it can cause that friction, and you don't want to cause that. And
yeah.
unfortunately, a lot of newer um medical students or residents, they don't realize the importance of making sure that things are actually placed on it in the correct way,
Yeah.
because they're not familiar with these tools. So if they're not familiar, they don't know the order.
Well, they
And
just need to attend the Lymphedema Patient Roundtable because you'll get
oh, I
all the
agree.
information you need every month. Thank you for sharing that, though, Catherine. And one of the things I love in chat, people are putting what they're saying no to. I love not answering work emails when you're on vacation. That is so good. I love you, Fenton, and I love what you said. Say no to giving up on yourself. Find the small victories, ask for help, and learn how to be better to yourself and your health, which is a perfect segue into a little bit of breathing and Zen with Karen Ashforth. And when Karen is done leading us through an exercise, I'd love each of you to leave our audience with a word of encouragement to close out this month's program. So take it away, Karen.
Thank you so much, Brenda. Oh, I just love this group and all of you. I mean, it just makes my month to be here. So, what I'd like to do now is to switch gears just a little bit, and we're going to end this group with a relaxing note. So, go ahead and take a deep breath and let it all out. And just notice your body making contact with the chair, with the sofa, wherever you are. Notice your feet on the floor. And as you take another breath in and out, see if you can just allow that exhale to go all the way down to your feet and allow your body to sink in another inch to the chair, to the couch. Just let yourself be carried for a minute. So, this message is an excerpt from a book called Gratitude. And this is for everyone, no matter what your spiritual beliefs are. And even if you don't have a specific belief in God, see if you can just let the words wash over you and acknowledge the divine spark that lives inside each one of us. Gratitude is a quality that can contribute immeasurably to our happiness, for it is an essential aspect of love. Indeed, it draws us closer to the ultimate source of all love. The more we express loving attitude for our blessings, great or small, the deeper will be our attunement with that infinite one and our awareness of infinite love. And two, the divine laws of abundance operate more fully in our lives when we acknowledge and appreciate the bounty of our spiritual and material blessings. It is so rewarding to recognize the good in each moment, in every experience. How then do we cultivate such gratitude? One way is to dwell on some circumstance in our life for which we feel truly grateful. It doesn't have to be a monumentous experience. a hint of some good done to us, maybe a smile that came our way and lifted our heart is sufficient. Remembering such experiences helps us to develop a spirit of thankfulness. Sometimes the greatest cause for gratitude lies concealed in the challenges we face, for they help to make us stronger and more compassionate human beings. The concept of giving thanks to God, even in the midst of misfortune, is a very beautiful one and often referred to in the scriptures of both East and West. More than that, it represents the truest perspective we can adopt. Even the highest and finest of the pleasures of this life are bound to come to an end. But God is our eternal well-wisher. And when we turn, whether in joy or sorrow, with a whispered word of thanks, we begin to transcend the fluctuations of earthly existence and to anchor our lives in a love that will endure forever. So, taking another breath, think about something right here, right now, that you're grateful for, big or small. I'll share that I'm grateful that I'm taking another breath and drawing in the richness of life. So with this, take another breath. Wiggle your toes and your fingers. Start to open your eyes. And we're going to get ready to close another wonderful roundtable. And as we do that, I encourage you to bring these feelings of gratitude with you, even after you log off, as you continue through your day and as you drift off to sleep.
You're muted, Brenda.
I was so zen, I forgot to unmute myself. Thank you, Karen, for sharing that. And, thank you, everybody, for tuning in tonight. We do have time just for one word, brief word of encouragement from everyone. I'll start with you, Catherine.
Oh, I forgot about that. Just honestly be your own advocate and speak up and really, make it a point to make sure that you feel heard.
Perfect. Angela.
It actually is what it is, but it is what you make it.
Ooh, love that. The dynamic duo.
Lean on your community. I think we feel so isolated living with this sometimes, but there's a whole world of us out here living this lymphedema life. So find your people and lean on them.
Yeah, and we are people who want to help. So yeah, we're here for you.
I love that. And Karen.
Life is so zen. In every good situation, there might be a little thorn, but even the bad situations, there's always something to be grateful for. So seek that out.
And I am thankful that I got to revisit. It was like a homecoming to be with all of you tonight. I have such immense gratitude to Lympha Press for being the kind of company that doesn't just supply pumps, but they supply support, really caring about you, the patient, and providing a forum like this. And then to have a champion on the team like Alexa, who is living with lymphedema and sharing her journey along the way and is the best host and moderator that this panel could ever have. So heart bows to you, Alexa, to everyone out there, and heartfelt wishes for an abundant and happy Thanksgiving, everyone. Have a great night.
Thanks, everyone.
Bye.
Bye.